tonight we're doing shelter management, emergency shelters, and during a disaster, our capacities change and we move to our emergency functions, which is ESF 7.
Slide it.
Okay, types of shelters. We have 4 types of shelters. One is an emergency shelter, a recovery shelter, a temporary shelter, and a transitional shelter. So in these 4 shelters, it's 4 different stages as well. In the emergency shelter, it would be more right when the storm comes in, when we get awareness to open the shelters and start accepting persons to come inside the shelter.
And just to break down, the main difference between the shelters is really the time frame during which it's opened. So for the emergency shelter, it's within the first 48 hours immediately, 72 hours immediately after the storm, 72, immediately after the storm. Then you have the recovery shelter, which is up to 3 to 6 months after the storm. And then you have a temporary shelter, which can be a little bit more long-term, extended up to a year, depending on the needs of the persons. And then you have the transitional shelter, which can go up to 2 years and usually involves a program helping the person to find a job, find a new place to live, and restabilize themselves in the community.
This transitional shelter also was made because of COVID. A lot of persons was displaced, and we created this shelter to help persons get back on their feet and get back to normalcy in life. So this is an example of an emergency shelter. Emergency shelters are a safe location that persons and the populace can utilize in the event of a tropical storm, hurricane, or any natural disaster.
Oh.
Emergency shelters are seen as a viable, safe shelter option, especially in situations where you have been instructed or have decided to evacuate and have nowhere else to go. Here are some pictures of some shelters. You might know, you might recognize, wow. Give me, who know where this one is?
This is 70 coming to South.
Correct. And here?
And that's what I hear.
And here?
I guess that be that.
And this pink one over here?
John Laminate, John now.
And this one?
There's a hair.
Yes.
You guys know where your shelters is.
So in total, we have, this year we have 10 shelters in total that are available to be activated if needed.
Here are the list of shelters. In the Phillipsburg area, we have the John Laminate Center, Great Bay Sports Auditorium, Little League Baseball Facility. In the Cul-de-Sac area, we have NEPA, Rupert Maynard Community Center, and Milton Peters College, the gym. Dutch Quarter area, we have Menfield Hazel Sports Center, Dutch Quarter Community Center, and Belvedere Community Center. And for over the hill, we have Simpson Bay area, Cold Bay. They will use the Christian Fellowship Church and Simpson Bay Community Center.
So now here we have what we call the shelter team. So these are the persons who come together to operate the shelter and take on the different roles required for it to operate. So we divided it into 2 sections. There are those who are always present. So there will always be someone in one of these roles at any active shelter. And then you have those that are on standby. So this is more operational and this is more tactical. So where you have a specific need or service that someone has to provide. So the ones that are always present are the sub-shelter coordinators, who fall under the shelter coordinator, which is the department head of CDFHA. And then you have the shelter managers. They manage the day-to-day operations. You always have the presence of the police and the military to ensure safety and order. You will have the Red Cross and or the WIEMS for medical purposes. And we also have the support of other foundations that will also fill in as shelter managers. And then on standby, you would have certain general practitioners for more complex medical challenges. You would have social services for psychosocial support in the event that maybe someone is having a mental health crisis or some other kind of mental challenge. You have the FBOs who are on standby for spiritual support for persons that are of that spiritual belief. You also have the Court of Guardianship for families with children, and of course, the Mental Health Foundation for more severe mental health issues. So in the actual shelter, with what we call the shelter team, so you have the shelter managers we mentioned before. You would have the shelter host or hostess. This is the person who would be designating persons to their area and guiding them in so that they're positioned well, seeing if they have any needs, if they need something to drink, something to eat, just as a host would do. The registration officer, that's the person you would meet at the front after you've gone through your security check with the police, and this person would guide you through filling out your registration form so that we have good documentation of who's in the shelter. And then you have the intake officer, and this is the person who would, for example, coordinate having persons lining up outside, already doing a quick scan to see if anyone is perhaps carrying a weapon or is inebriated, so that can already be addressed before they even get to the registration desk. In addition to these roles, you can also be asked to assist with, for example, and this would more come beforehand, identifying vulnerable homes and encouraging persons to use the shelter, because one thing that tends to happen is persons will till the last minute to run to the shelter. So we always try to, go through the community and encourage persons, if we see that the home may be vulnerable, to consider a nearby shelter. And you may also be asked to perform first aid, which basically everyone on the shelter team will be trained to do. And here we have an example of what we call your go bag. And so we encourage everyone to have a bag with items such as these. So it's not a definitive list. It's just an example of some things that would be useful for you to have so that in the event of an emergency, you can grab and go. And you see the examples: water, ready to eat food, very important, your passport, your ID, and any other very important documents, sealed in a plastic airtight container to prevent water damage. Your basic toiletries, toothpaste, toothbrush, soap, deodorant. If you have any medication, it's always good to stock up on that beforehand to prevent a crisis when you're in the shelter. If your bag is big enough, maybe you can fit a small pillow or some sheets, your cell phone and charger, assuming the current comes back quickly. Small radio is always a good idea so you can keep track of what's going on. And a flashlight and a whistle in case you maybe have to move from one location to another in a rush.
And for those that have children, you try to walk with their favorite toy or their favorite snack so you could have them a little at ease in that difficult situation. Who can use a shelter? Residents, non-residents, undocumented persons, anyone. We don't discriminate under the emergency. We don't discriminate. So anyone can use the shelter. A potential shelter client must present a form of ID and complete a registration form. To ensure the safety and smooth operation within the shelter, rules are in place and is enforced. Now, a couple examples of the shelter rules. We have no weapons, no alcohol, no drugs are allowed, no obscene language, no destruction of property or stealing, no cooking in the shelter, no smoking, no sexual activities, no pets or animals allowed in the shelter. Keep your area clean at all times. Guests must be dressed appropriately at all times. Keep your valuables with you at all times. Cell phone usage must not violate the quiet areas and the lights out rule. Follow any instructions given by the shelter management team. Now, they are the general rules. However, in a situation like COVID where we have extra rules, then this list would be amended and it would have to stuff like make sure wear your face mask at all times, practice social distancing, cover your mouth, keep your hands clean, for just an example of some of the rules.
And so here we have a sample floor plan to show you how we would normally arrange persons, arrange the shelter itself. This example is the Melford Hazel Sports Center. And so this is the entrance coming in here. And so you would always have the registration desk with the police checkpoint together. So the persons would first have to go through the police checkpoint to make sure that they don't have anything that would not be allowed in the shelter, and to make sure that they are in a good state, that not under the influence or anything like that. And then you would go through the registration process. So out here you would have, for example, intake officers that would be lining persons up and, you know, seeing if they have any immediate needs. So once you come in, you would have the shelter manager is usually set up here near the entrance where they have an overview of the shelter. We always try to keep the seniors and the families close to the police checkpoint and to the shelter manager, because usually the seniors would more likely have need more care, more attention, more needs, exactly. And so we also try to position them close to Red Cross and WIEMS in the event of an accident or an emergency. And of course, we separate the females from the males and position the females together with the families, because oftentimes you would also have a lot of single parent families where it's a mother and children. And so this is just an example. Of course, every shelter would vary depending on the space, but this is just the thought process of how we divide persons to try to keep peace within the shelter. And so, yeah, so I don't know if you can see it, it might be a little small, but the positions are highlighted in blue. And yeah, that's the floor plan. And these are just some pictures from previous years, previous trainings, persons that were actually part of shelter teams. This is here at Melford Hazel. This one is also Melford Hazel, I believe. And this is outside. And we thank you for your attention.
Good evening, everyone. My name is Aviera Jessamy, and along with my colleague, Michaela Hart and May West, we are EMTs and First Aid, BLS, and CPR instructors with WIEMS. So tonight we're going to go over some basic information about WIEMS, some basic information on CPR, stopping the bleed, and general first aid that you would have to render during a disaster situation. And then we will have some demonstrations with you guys on how to stop the bleed with a person that's having a situation where they get injured and they need to stop the bleed, as well as how to help a person who is choking. WIEMS is an organization that has been around for over 30 years. And we first started on the island as first aid. All our members have, at the minimum, EMR training, which is emergency medical responders. But most of us, like myself and Michaela and May, we are EMTs. Not all WIEMS members are instructors. That is a separate certification. But today you're lucky we have not only EMTs, but also instructors. May is our star instructor. She's shy, but May is our star instructor. So what we do generally in shelters, we offer medical assistance in the sense of when you come in, we help you take your medication. If you have any dressings that need to be changed, we will change your dressings, check up on you, monitor that. If we have any elderly persons, we check on them a little bit extra. Sometimes, for example, during Irma, I had a mom that just had given birth the day before. She had a C-section, and again, emergency protocol in the hospital. She's fine. She had to leave. She had no home to go to, so she came to the NEPA shelter. So in her case, we would help her with the baby. We help change her dressing and clean her wound every day and make sure she's okay.
The courses that we offer.
Yeah. So WIEMS offers several courses that we do for certifications. Our first courses that we offer, we have Stop the Bleed classes, which we offer as a demonstration. We also have Friends and Family, where you would get basically just an introduction to first aid and CPR. Then we also have our CPR and first aid courses. You can take them together or you can take them separately. All our certifications last for 2 years. We are certified through the American Heart Association. We are certified through the American Heart Association for our first aid courses. And we are also certified through, the name is blocked in my head, but we're also certified separately, no, not through the Red Cross, separate organization, different certifications. Red Cross, if you notice in the presentation they give, Red Cross will offer, they help with first aid. They are not EMRs and EMTs. So their training maxes out at first aid. So for WIEMS, there's first aid. Then we have BLS, which is basic life support. We also offer this class and we teach. So all our instructors are at the minimum BLS certified. And then addition to that, we have the EMR course. So you have to have either CPR or BLS certification to do EMR. And once you've done EMR, then you can do EMT. So for example, ambulance drivers, etc., those would be EMTs. So those are emergency medical technicians. Yes, those on the airport, the firemen on the airport, they're all EMTs. They're certified with us as well. So with our courses last 6 hours. You'll have your certification. It's test on demonstration based. So everything is video based. You don't have to study. We make sure that you're comfortable with all the work you do. You have sufficient practice. We have our mannequins, our wonderful mannequins. And people like the babies. They love the babies. So we teach you how to do first aid and CPR with adults, children, and infants. So we want you to be comfortable that you can help a stranger, you can help a family member, because emergencies happen any and every time. So especially in a disaster situation, most of the time the injuries that you would have to tend to would be to stop the bleed, would be to do applying a tourniquet, and would have to be splinting. So maybe somebody broke a bone, you would have to set that bone, or if somebody cut themselves, you would have to know how to stop that bleed. One thing I will let you know tonight, rubbing alcohol and peroxide is not your friend. It's never your friend. I know our grandmothers, our mothers would tell us that rubbing alcohol, peroxide, those bubbles don't mean you're killing the bacteria. Peroxide does not distinguish between healthy flesh and damaged flesh. If you have an injury, the easiest thing you can do and the best thing you can do is soap and water. Someone has a cut, soap and water. Soap and water. First, and then you can apply aloes for a burn, for example. Soap and water, you clean it, because while we feel like rubbing alcohol and peroxide is wonderful, it damages the tissue. If you get a burn, room temperature water. Just run water on the burn. Okay? No toothpaste, no butter. Because what that does, it creates a barrier and it holds in the heat. So that you're going to continue burning from inside. Water. Just water. And I'm speaking from experience because I'm a professional burn victim. Okay. So, you're not a... No, what?
Yeah.
Oh, okay. Oh, no. Sure. Yeah. We did that. So we're going to go through some simple definitions this evening so you're familiar. So CPR stands for cardiopulmonary resuscitation. Okay? So you use CPR in situations where a person is non-responsive and not breathing. So if they're non-responsive and they're breathing, we do not use CPR. Okay? So this is an emergency life-saving procedure when the heart stops beating. So if the person is not breathing and they're not responding, when you tap on them, you shake them, then you would go ahead, you check they're not breathing, you do CPR. An AED is an automated external defibrillator. What this does, we attach it to the chest and to the side, and it connects to a machine. And what that machine does, it monitors and checks for a heartbeat. If there's no heartbeat, the machine will let you know, and it will issue a shock to try and restart that heart. What it does also is sometimes you will have to perform CPR on a person where they will have an irregular heartbeat. So the person might come off sometimes either as they have no pulse or they have a pulse but the pulse is irregular. So they will still be unconscious and non-responsive, and they will also not be breathing. What the AED does, it either starts back the heart or the shock will get it back into its regular rhythm. Okay? First aid. This is the initial help in action or medical care given for an acute injury or illness. Okay, so not you cut your finger. That's not first aid. You just tend to a cut. All right? It can be minor assistance like cleaning and bandaging minor cuts and scrapes, but it can also be fast-acting help to someone to help someone with a life-threatening, medical emergency. Heart attack. All right. So for heart attack, you should call for help immediately if someone is experiencing a heart attack. Signs of a heart attack include chest pain, pressure, discomfort, shortness of breath, nausea, or sweating. Prompt medical intervention can help save this person's life and reduce damage to the heart. Ladies, I want you to go today and do a little bit of homework. When you go home, Google signs and symptoms of a heart attack in women, because most of these signs and symptoms you will not experience. Signs and symptoms can be very different for women, and we are very much good at covering our pain and say, oh, we're okay. We're okay. So do your homework today. When you go home, Google signs and symptoms of a heart attack in women. Difficulty breathing. If someone is having difficulty breathing, call for help right away. Trouble breathing can result from conditions like asthma, allergic reactions, heart issues, and without quick assistance, the person's condition can worsen very rapidly. This can also include someone choking, so make sure you help them with that. Unresponsive. I said unresponsive earlier. You may be asking, what is unresponsive? So an unresponsive patient is someone who does not react to external stimulation. So you come, you tap them on the shoulders, you say, hey, are you okay? Are you okay? And you get no answer from them. All right? And should never be left alone without medical attention. Loss of consciousness can indicate a severe medical problem, such as a head injury, stroke, or cardiac arrest, requiring an immediate emergency response. Check to see if this person is responsive, but do not move this person if it's not an immediate danger in the vicinity. So if we're in this building, there's no immediate danger around me, and I pass out, I'm unresponsive, do not move me. Okay? You don't know if I fell, and while I was falling, I hit my head, and moving this person, you can further injure them. Okay? So you tap them on the shoulder. Don't shake them. You tap, 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 tap. If it's a small individual, like the little baby over there, you tap on the bottom of their feet, and you try and get a response from that person, okay? Or you rub in the middle here of their chest. Uncontrolled bleeding. In cases of uncontrolled bleeding, call for help immediately. Severe bleeding can lead to significant blood loss, shock, and death if not treated quickly. Applying pressure while waiting for emergency services can help control the bleeding temporarily. Sometimes applying pressure might not even work, then you would have to apply a tourniquet. If you don't have a tourniquet in your first aid kit, you will have to make one. Very easy to do that. All right, so now in your first aid kit, everybody has those beautiful first aid kits. I think government was giving them out of time in the bags. Lovely. Who here restocks their first aid kit? One person. You use those bandages, and then one day you go and go look for a bandage, there's no bandage. Every first aid kit not only comes with most of the things you need, but also it comes with a list. And that list will let you know what you need to restock your first aid kit. Go home and restock your first aid kit, because I'm sure it's more than just the plasters you're missing. All right? And also, things expire. And you ever went and you put a plaster in your hand and not sticking anymore, and that plaster in there since your grandchild was in kindergarten? Restock and replace. Bandages and plasters are not expensive. All right? Open the scissors. Check to make sure the scissors is not rusted shut. All right? The gloves, yes, replace them. swap them out. Add a few more. If your first aid kit comes with only 2 pairs of gloves, try and get some more extra gloves. Get nitrile gloves and not latex gloves, because the person you are helping might be allergic to latex, or you may not be allergic to latex, but using latex gloves over time, you can become allergic to using latex. So it's best to just use nitrile gloves from the go. Size large fits most people. Buy a pack of size large, keep some in the first aid kit, change them out every few. All right? Yes, we have rubbing alcohol, but again, not for a regular cut. This is for big situations. All right? Let's say you fall, you cut your leg in some dirty water, then yes, we want to use it, because in that case, it's doing more help than damage. All right? But if you cut your hand cooking, run it under the sink. But if in a hurricane or in a disaster, you're in some water and you don't know what's in that water. We want to mitigate your risk of infection. So in this case, the rubbing alcohol does more help than harm, all right? Your personal medication. If you can't have extra medication in your first aid kit, have a list of the medications you use, all right? So you have a list in there, or if you have a family member that is ill, elderly parent, etc., have a list of their medications in that first aid kit. A tourniquet. You can buy a tourniquet online. Most first aid kits do not come with a tourniquet. A tourniquet is if you're bleeding. We have one there. We can show you. So this is a professional tourniquet. You use it on extremities, so your arms and your legs. So if you're bleeding uncontrollably and you're applying pressure and the bleeding does not stop, you will have to apply a tourniquet. If you do not have a nice fancy one like we have, we will show you in our demonstration in a bit how to make your own tourniquet, because everybody here have a headscarf. Everybody here have a headscarf.
Oh, that's solid, buddy.
You don't have to have it on you all the time, but you will add one in your first aid kit. If you cannot get a tourniquet, you can always get a scarf. You add your little scarf. They cost $1 or $2. And you keep one in your first aid kit along with a spoon. A spoon and a scarf, and you have a tourniquet.
Yep.
All right? We're going to come back to the stopping bleed. We're going to do these in our demonstration. We're going to also show you how to properly remove gloves. Because what's the point? And you're protecting yourself, and then come to take off the gloves and you go and you get yourself contaminated. It's not just blood, people. It's not just blood. Pee, poo, all the fun stuff. Okay, we'll also show you demonstrate on how to help a person that's choking. All right, so now for CPR. Again, today we're not going to do the class because you need to take the class. But we can give you some basic steps on what you would need to do. If you've taken CPR training before, this is just a refresher. The most important thing, scene safety. I like to tell all my students when I'm teaching a class, helping a person is a very selfish, not selfless, it's a very selfish act, because you are purposely putting yourself in possible danger. So always make sure the scene and you are personally safe. So that's not only what you see, but that's what you hear and what you smell. Because you might not see anything, but you smell gas. Are you safe? No. You might not see or smell anything, but you hear a dog growling. Are you safe? No. If your neighbor and her husband had a fight and he pew, 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 you are not safe. The police have to come. Because if that's my neighbor and I read your EMT, I'm sorry, I'm not even looking out my window. I can't help you. When the popo come, I will call the police for you. I'll call the police. Helping someone is very selfish. It might sound harsh, but if you go now and you helping your neighbor and you now get attacked, now we have 2 victims instead of 1. All right, and especially St. Martin, we only have so much ambulances. All right. Check for responsiveness. Remember? Tap. Hard. Don't come. Tap. If it's a coworker you don't like, take a little extra aggression out. Are you okay? Are you okay? If you know their name, call their name. Suzanne, are you okay? Are you okay? Suzanne. Suzanne is not talking. Suzanne is not breathing. Suzanne is unresponsive. Shout for help. Call for help. Okay? You shout for help. If you have your cell phone on you, call 911. Put it on speaker and keep it next to you. The 911 operator will help you through if you need to do CPR. Even if you've taken a class before, even if you're certified, they will help walk you through, help you keep your proper timing, etc. Check for breathing, because if the person is unresponsive and they're breathing, do we need to do CPR? What do we have to do? You stay with that person. Talk to them, even though they're unconscious. Talk to them. Suzanne, I call the ambulance. I'm staying with you. Rub their hand. You know, talk to them. I'm going to stay with you. The ambulance is coming. The dispatcher said they're 5 minutes away. Okay? Don't worry. I have you. I stay with you. And you stay with that person, okay? Until the ambulance comes and the dispatcher tell you, okay, you can stop. So, if the person is not breathing, you're going to start CPR. 30 compressions, 2 breaths. So after every 30 compressions, you do 2 breaths. 1 cycle of CPR, which is 5 sets of 30 compressions and 2 breaths, lasts 2 minutes. 2 minutes sounds very short. So 1 cycle of CPR is 5 sets of 30 compressions and 2 breaths. All right? Sounds like a short time. But this is 2 minutes is not long, but it's very labor intensive. All right? And you already have your adrenaline pumping, because this could be your family member, your husband, your wife, your neighbor, your child. So you already have adrenaline pumping. That 2 minutes will feel like forever. All right?
Yeah.
What you can do, most first aid kits nowadays, they come with a one-way pocket face mask. Again, helping somebody is very selfish, but what we're going to do is always protect ourselves. I am not giving none of y'all mouth to mouth. I love y'all, but I'm not giving anybody mouth to mouth. All right? Because protect yourself first. Like I said, most first aid kits nowadays, they come with a pocket face mask and a one-way valve, so you put that on the person's mouth and you do CPR. The young lady there, she has one in her purse on her keychain. So you can use those. Those are disposable ones, one-time use, but you can get the actual reusable ones, and the mouthpiece is all you would have to replace. You can buy those online. They're not expensive. You can buy them from us. They're also not expensive. You do not need an AED. Those are expensive, but public buildings should have them. If you do not have a pocket face mask, again, we are not doing mouth-to-mouth, because I'm not going to tell you to endanger yourself. But if it's your child, absolutely. Your husband, if you like him, absolutely. Your wife, does she cook? Cool. If it's a stranger or you do not feel comfortable giving this person mouth-to-mouth, you do hands-only CPR. So you just continue the 30 compressions to the 2 breaths until the ambulance comes, or if somebody who is more advanced than you comes to help you. All right? If you are working in a building or in the shelter and there's an AED, send somebody to get that AED as soon as you start helping this person. So from the time you realize this person is not breathing, you say you know the person's name? You, go and get an AED. All right? So by the time you've done the first set of 30 compressions to 2 breaths, they're attaching the AED pads to that person. The machine is going to start to read. The only time you listen to that machine is when the machine says, clear for analyzing. Because you cannot touch that person, because the machine can misread and read your heartbeat because you're touching that person. The second time you do not touch that person, the machine has to analyze. When it says no heart rhythm detected, shock advised, the machine is going to light up with a red light. We all know that red button, and you know your intrusive thoughts is like, I want to press it. Let your intrusive thoughts win that day. Press the button. But before you press the button, make sure you and no one else is touching that person. Because a shock that can start a heart can also stop one. And then bap, you shock and know your neighbor on the floor with you, your other neighbor.
Good.
All right, so you make sure this is the day where you are the authority. All right, you tell them clear, move. We're not suffering nobody feelings. Your neighbor get vexed with you because you tell them move and you push them out of the way. That's okay, their life to be vexed with you, right? All right, so we're going to go scene safety. So remember, it's not only what you see, but it's what you hear and what you smell. All right, once that is clear, you check for responsive, tap, 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 tap on the shoulder. If not, you can rub here in the middle of the chest. Shout for help and call 911. Shout for help, okay, help, help, loud. Let your voice flow. Check for breathing. Okay, you look for chest rise and chest fall. All right, you do that for between 5 to 10 seconds. If you don't see the chest rise and fall between 5 and 10 seconds, You do that 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi, you're not seeing anything. By 6 or 7, you can already start, put yourself in the position to do CPR. When you're doing CPR, what you're going to do, you're going to place your hand in the center of the chest. Okay, so right, you know the sternum? That plate right in the middle here is cartilage. So you're going to put your hand in the center right below the breastbone. So not here in the center, a little bit below. And you're going to push down about 2.5 inches. Yes, sometimes ribs can crack. But you know what heals? Ribs. You know what doesn't heal? Death. We can't heal from death, but we can heal for some broken ribs. Okay? All right. So you do that 30 times. If you're not sure about the rate you need to be doing, which is about 110 compressions per minute, what you can do, Spotify and YouTube, they have what is called CPR playlists. So they have songs that have the correct beat and rate for CPR. So some common songs, BG Staying Alive, perfect for CPR. For your younger ladies, Cardi B, yeah. WAP. There's several other songs. There's a whole playlist on Spotify if you have. You don't even need to have a subscription. Baby Shark, doo-doo, 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 Baby Shark, doo-doo. There's several songs. A lot of songs we all know. It transcends generations. So whatever song you like, that's your song. You sing that song while you're doing your compressions. If you have a neighbor or a friend that can help you, y'all switch out every 2 minutes, even if you're not tired, because you need to stay fresh, because you don't know when the ambulance is coming, especially in a disaster. All right? Okay, so now we go back. My colleagues are going to assist you, ladies and gentlemen, with some demonstrations on how to stop bleeding.
So my name is Michaela Hart. Like Xaviera mentioned, I'm also an instructor. And out of curiosity, how many of you have ever taken a first aid or CPR class?
What?
Okay. So you remember how to bandage a wound? Okay, so who has not taken this course before? You can raise your hand a little higher. Okay, so what we're going to do is we're going to practice stopping the bleed. And before we do that, we're going to demonstrate it together. The first thing that you always need to ensure is that you are safe from any bodily fluids. So let's just say I have a wound on my arm. I cannot contaminate myself. I cannot contaminate myself. So I can always put my hand on top of the wound to at least start the process of stopping the bleeding. In the meantime, that gives the person who is going to be assisting you a chance to put on their gloves, get the material that is in the first aid kit, and then come to your assistance. Okay, so I have a wound on my arm. And May is now going to place gauze on top of the wound. And with gloved hands, she's going to apply pressure. When you're applying pressure, you do not use the tips of your fingers. You use the palm of your hand. You don't want to cause any additional pain. After a while, you're going to check to see, is the blood coming through? Is it soaking the gauze? Is it stopping with the bleeding? What you're not going to do is remove the gauze because you're going to restart the clotting process. So if it's still bleeding, you're going to put some more gauze. Once it stops, you're going to bandage the wound. When bandaging, you're going to start from the bottom and you're going to go up. You're going to ensure that it's tight enough so that it stays in place, but not so tight that you stop the circulation. And also that it's not loose so that it slides and then it removes. Turn this way so they could see.
Down.
Okay. So with the bandage, you want to ensure that the gauze is properly covered from the top and the bottom. Once that's done, you can use a scissor to cut and secure it in place. Okay? You're not going to go down again. You're just going to go up, and once it's up and secured, then that's it.
So now I will show you a demonstration on her arm so everybody can see. All right, Michaela has a cut. We've tried to bandage it and it's still bleeding. So that means applying pressure was not working. She's still bleeding. We're in a disaster situation. She can bleed out. So what I'm going to do is apply a tourniquet. So I'm going to take her hand gently. Okay, remember, the cut is here. We're still doing our imaginary forearm cut. I'm going to place the tourniquet above the joint. Okay, so you always place the tourniquet above the injured area and never on a joint. So I'm going to place the tourniquet. I'm going to put it tight. Well, not in this case, not really, but you apply it tight. Does it hurt? Yes. Is it going to save their lives? Yes. Sometimes pain is good. All right? So you're going to take this Velcro strap and you're going to put it as tight as it can possibly go. It still will not stop the blood. You're going to see bleeding. It might slow down a little bit. But what you're going to do, you're going to take this. This is called a windlass. All right? This little piece here is called a windlass. So I'm going to turn it and turn it and turn it. And it's going to get tight and tight and tight. And yes, it's going to hurt a lot. But what it's going to do, you're going to turn until you see the bleeding stops. Once the bleeding stops, I'm going to take this piece of Velcro off. And it's going to naturally lock either down or up, depending on when the last turn was. So once it locks, I'm going to place this here. This tourniquet has a little notification here that says time. I'm going to write on the time I put on the tourniquet because after a certain amount of time, the limb will have to be removed. So when we get to the hospital, the doctors need to know how long this tourniquet has been on. Is it a matter of amputation or is it a matter of we're saving the limb? All right, on too long, remember we cut off circulation. So what happens to limbs when they're not getting no circulation, no blood, no oxygen, no nutrition? It's going to start to die. Not only that, at a certain point, it's going to reach where if they take off the tourniquet and they release it, all the toxins that have built up here are going to go into the person's body and they're going to go into toxic shock and they're going to die. Everything will start beeping. They'll be very popular in the hospital. You don't want that kind of popularity. Okay, everything is going to start blinking. All the sounds are going to start sounding. All the nurses are going to start running. All the doctors are going to start running. You're everybody's best friend that day. You don't want to be their best friend on the day. All right. So now this is with our nice fancy tourniquet. On this hand, on the other hand, we're going to do, remember, our scarf and a spoon. Don't use a fork. Don't use a knife. But if that's all you got, put the fork facing upward. So this is not, the tines are not downward. If you're using a knife, use a butter knife. But I'm sure everybody could find a spoon. You can't find a spoon, find a hard stick. All right? We improvise it. But we're assuming you're home and you have your kitchen, you have a spoon, and you have your headscarf, which is no longer your headscarf because now this is a tourniquet. You fold it up, nice and neat like this. If you listen, in an emergency situation, hold this. You don't need to do that. And you're good to go. All right? It's not about neatness. There's no points for neatness. It's about saving lives. Sometimes saving lives is very unneat and very messy. So, same thing. Injury here. Again, it's not a problem to have the person help you. You don't need to hold everything. You can have, you see, have Michaela holding the spoon for me. Ow, 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 her hand is hurting her. So we're going to stop. Again, same place. I'm going to wrap around. Okay? Now I reach here. I'm going to make a knot. Oh, no, it's sorry. Sorry. We just do one. We're going to tie it as tight as we can tie it. Then we take the spoon. We're going to put it in the middle here. And we're going to tie it again as tight as we can get it. Okay, so now it's tight. Let me make it a little tighter. It's not too tight on your hand, right? Okay. So now we're going to use the spoon as our windlass. So you're going to twist and turn and turn and turn until you see the bleeding has stopped. Once the bleeding has stopped now, do not let go of the spoon because the spoon will swing like a propeller. All right? You can ask the person to help you while you take the ends of the scarf. So you can ask them, hey, can you hold this for me, please? If you can't hold the two of them and tie them. All right? But what you do, you hold the spoon in place. If you can't, Michaela, can you hold the spoon for me, please? Okay? So the spoon is going to move. Again, like the same thing with the windlass on the tourniquet, it's going to have the direction it wants to go in the opposite direction of what you twisted it. So if you twisted it right to left, you're going to have to wrap the scarf left to right. All right? So I'm just twisting now right to left. All right? So now it's tight. It wants to go back the other way. So what I'm going to do is I'm going to tie now the tourniquet to go the opposite way. So, all right? Tie this the opposite way. So now it locks in place. And I'm going to take this and I'm going to tie it as tight as I possibly can and knot it. If the string, the ends are long, what you can do is you can make a bow because you don't want to have anything drag in because you don't know where you're going to be. Let's say you have a lot of debris in the house or whatnot. It can attach to something and it'll pull. All right? Not only will that hurt the person, that can also further injure them, or that can loosen or cut the tourniquet, and now you have to start all over. All right? And when blood starts back flowing a second time, it's like a gush. You're not going to be able to stop it. All right? So again, same thing in this case. We don't have a beautiful little piece of thing here that says, write it down. Add a Sharpie to your first aid kit. Because what you're going to do now, you're going to take and you're going to write down the time that you put this tourniquet. Where are you going to write it down, you may ask? Right here. Right here. Okay? If you don't want to write it here, on the back of the hand. Or you can put it above the injury, but I would recommend right here on the forehead. All right? Use that Sharpie. It comes off. You don't want to, because you're not going to remember the time you put it on. But it's there. Everybody can see. And you're not going to be with them at the emergency room. Put it on the top of their head. So again, they know how long the tourniquet has been on. And then they know also what procedure they would have to do if it's saving the limb or if it's a situation where, hey, we're going to have to amputate because it's been on too long. All right? I will be the example. I am choking. Oh my gosh, the universal sign for choking. Most people, regardless of language, age, race, or creed, we do this when we choking. Everybody. It's instinctual. All right? So I am choking. So.
So the first thing you do is ask, can I help you? Are you choking? Because you don't want to just go behind somebody, they're choking, and then you startle them.
If a person is choking and they're coughing, leave them cough it out. Because in order to cough, you need to inhale. Try and cough it out inhaling. In order to cough, you need to inhale. You need to, so you could cough. So that means they're able to breathe. Okay?
Yeah. So, can I help you? Are you choking? What you're going to do is you're going to find the person's belly button. You're going to make a fist. And you're going to place it right above the belly button.
Okay, so right above my belly button, which is right here, she placed a fist. Her hand is like this. Okay?
So the position as well, you're going to put your foot in between the person's feet in case they lose consciousness and you need to bring them slowly to the floor. So you're going to stabilize yourself. You're going to find the belly button and you're going to push in and up.
So this motion.
In and up. All right? And you're going to keep doing that until the item comes out or the person loses consciousness. And then you bring them to the floor and you start CPR.
So if the person passes out, that's the reason we stand braced, because the person would then be dead weight and then both of y'all will fall on the floor. Whereas this way, you want me to do it? This. So you could take me down? Or you want me to take you down? Come, I'll take you down. So we do it from the side this way. So now, my leg is braced between her legs. My foot is braced. So I am holding myself here like this. I'm able to help her. I can maneuver, but I am braced. So now, okay, she's choking and she passes out. Pass out. Pass out. Okay, so now I have her, and I'm using my leg as leverage to help me get her down. All right. Ta-da! I didn't injure myself. She didn't fall. And now I can go ahead and do what? CPR. CPR. All right? So always brace. Never stand up like this. Because when a person falls, The same thing when you're giving CPR. I always get students in class, they want to be one knee down like this. Please brace yourself, knees apart, one at the shoulder, one at the navel, because you are braced on your knees. Because if the person just gasps when they get up, you're going to reach back, you're going to fall and injure yourself. But if you're braced, you are placed in a perfect position that you yourself won't fall and injure yourself. All right? If it's a child, this is not infant, so if it's a child, you can go down on the knees and do the same thing. All right? So a child and adult, a child would be considered anybody older than 2. But again, use your discretion. Some children, they're older, but they're very small. All right? So you will go down to their level and do the same motion. Remember, hand. So in and up, in and up. All right? With a baby now, this is very scary for a lot of people because, again, it's babies. What you're going to do is hold the baby's head like this. So your hand is going to be between the nose. My face big, that's why, because babies are a lot smaller. They can fit in your hand. So you're going to hold your hand like this, all right? See the V here? The baby's nose is going to be here in the V. So my hand will cover the mouth, but I'm not covering the baby's nose, all right? So I'm supporting the baby's head at all times. I'm going to have myself at an angle so you can sit in a chair and put one foot out. What you're going to do, you're not going to slap the baby's back straight down. Forward motions, all right? Between the shoulder blades, hard. Babies are very resilient, okay? Who here has not had their baby fall? Okay, babies are very resilient, okay? They're basically indestructible. So, I did say basically, because these children that get themselves in places they should never be. So, again, hand is here. I'm always supporting the head, okay? Downward angle because you're going to have gravity help you, and you're going to give 5 back slaps, all right? Then you're going to take the baby, turn, holding the baby's head. Put the baby half of the body on this side and half on this side. So one leg on each side that helps you balance the baby. You're going to check in the baby's mouth. If you can see the object and easily remove it, you can just reach in and take it out. But if you can see it, but you can't easily remove it, do not try and take it out, because what you can do is then push it further back. If you can't get it, okay, you can't see it or you can't reach it, you're going to give 5 compressions to the center of the baby's chest with your 2 fingers. All right? Ladies, you have on nails? Knuckles. Now, I'm saying if you're wearing nails, knuckles. If not, you can use the pads. If you can use the pads of your fingers like this, because then the nails will be sticking out, you do the pads of your fingers. If not, you can use your knuckles. You do 5 compressions. Switch the baby around, 5 back slaps. Switch the baby back, check. If you can remove the item, or at the back slap stage, if the baby starts crying, good. A crying baby is a breathing baby. Yep. All right? So we want that baby to cry. After you've done this for an adult, a child, or an infant, they need to see a medical professional. All right? They may incur injuries, they may incur bruises, or they may just be perfectly fine. But again, bruises and injuries heal. What does not heal? All right. Okay? Crying babies are breathing babies. There's 2 times you want to hear a baby crying. Is the most beautiful sound. That's when that's when they're first born, and that's if they're in trouble. Quiet babies are never good. They're either up to mischief or something is very wrong. Okay, if you're by yourself and you're choking, there's nobody to help you. If you have a kitchen counter or a table and you can reach this level, run yourself into it. Yes, you run yourself into it. Because what heals? Bruises, scrapes, and broken bones. But what does not heal? Death. When you are panicking, you will not feel that pain of you running into that table or that counter. Adrenaline is pumping through your body. You will not feel that pain. You will wake up the next day. You can't breathe because your chest hurting you so bad. But guess what? You're breathing. If not, you take a chair. We're not going to do like Sierra and float on the chair. You're going to, okay? Preferably nice, those thick wooden chairs. If you have one, use those. All right? But most people counter height. If not, you can run into, I'm short, so most things is counter height for me.
That could.
But if you're taller and there's something that is your way above your belly button, remember it's the same height above your belly button, you do the same thing. If the person is larger or the person is pregnant, you can't do compressions in the abdomen. You do here by the chest. So you go above the stomach. Okay, this is only if the person is large or if the person is pregnant. And what I mean by large, I mean if you can't get your hand around the person. All right? Because what I would consider large and what the gentleman would consider large might be different because his hand is longer and he's stronger.